Belgian Oncology TV with Professor Jérusalem from the University from Liège to comment with us at ESMO the main sessions on breast cancer. Professor Jérusalem, thank you for being with us. What did you retain about the sessions on breast cancer this year?
I think the most important presentation was, of course, in the presidential session, the overall survival data from the Cleopatra trial. So I think it's really great news for our patients. In the past, this was the subgroup of patients with the worst prognosis, and now we see major impact on overall survival. So rapidly, the Cleopatra trial was for patients with HER2-positive disease, first-line metastatic setting. The patient received docetaxel, trastuzumab, and then either pertuzumab or placebo. About 800 patients were randomized. In the past, we had already seen that there is a 6 months improvement in progression-free survival from 12 to 18 months, but now we have seen the final data for overall survival, and it's nearly 5 years, it's 4.5 years that the patients survive when they had received pertuzumab. So it's about 16 months improvement in overall survival. And we know it's so difficult in general to see an overall survival benefit, in particular if you are in the first-line metastatic setting. And here at 16 months, this is really impressive and very important news, because this say, if it is the median, that half of the patients will live longer than 4.5 years with a metastatic disease. So really it's great news. And then in particular also, not only we are improving the overall survival, but the treatment is very well tolerated. In general, when we do better, unfortunately, we are also much more toxic. If you look to the grade 3-4 toxicities, it's not so much, and it's mainly neutropenia, febrile neutropenia, and diarrhea. And for us oncologists, these are easy to handle side effects. So really great news. And in particular, also the cardiac safety has been again confirmed. So really a highly effective drug and a highly acceptable safety profile.
So the dual blockade of HER2 is a standard of care in this setting?
Absolutely, and fortunately in Belgium we have the access to this combination. So I don't think that we can no longer discuss any other option. With this overall survival benefit, all the patients in first line should receive this drug combination if there's no absolute contraindication, cardiac contraindication, for example.
You don't have any official presentations here? We have to wait to San Antonio to see something from you?
Yeah, my next presentation with original data will be in San Antonio. We will present the results from the first analysis from the Ballet trial. So these are about 3,000 patients that have been treated with everolimus and dexamethasone in patients who failed non-steroidal aromatase inhibitor in a real world setting, many centers. And I think it's very interesting to see if we are able to reproduce the results and the good safety profile seen previously with this drug.
Okay, we hope to see you there. Thank you very much for this interview.